Have you ever wondered if your arteries are silently aging faster than the rest of your body? Maybe you're in your 40s, 50s, or 60s watching this from anywhere in the world, and you've been told everything looks fine on the surface. But what if I told you that right now, without any symptoms, you could be walking around with arteries that are decades older than your actual age? What if the very habits you thought were protecting your heart were actually setting you up for a silent disaster? This is exactly what happened to someone who ran marathons, avoided fats religiously, and did everything the medical world recommended at the time, only to discover the shocking truth during a routine test. If this story resonates with you, or if you've ever felt confused about what really works for heart health, stay with me, because what you're about to learn could literally save your life. Please hit that like button if you find this information valuable, share it with someone who needs to hear this message, and drop a comment below telling us your age and where you're watching from. Let's build a community of people who refuse to become another statistic. Journey begins with a devastating discovery at age 57. Imagine believing you're the picture of perfect health, running marathon after marathon, carefully monitoring every gram of fat on your plate, only to find out your arteries tell a completely different story. A simple test revealed arteries that belonged to someone 16 years older. The arteries of a 73-year-old trapped inside a body that should have been thriving. The shock wasn't just about the numbers. It was about the realization that 50% of heart attacks happen without any warning signs. One moment you're living your life, and the next moment, everything ends. No chest pain, no shortness of breath, no warning whatsoever. This terrifying reality became the catalyst for a complete transformation. The test that revealed this hidden danger was called a carotid intima media thickness test, measuring plaque hiding inside artery walls in the neck. Understanding this wasn't just a neck problem, but a whole body metabolic issue changed everything. The revelation sparked both frustration and determination to fight back against a ticking time bomb. Within just 1 year of making strategic changes, those arteries transformed from 73 years old to 52 years old, a reversal of 20 biological years. The most advanced heart scan available today now shows that dangerous soft plaque has essentially disappeared, reducing the risk of sudden heart attack to practically zero. This isn't about luck or genetics. It's about understanding the root causes of arterial disease and addressing them systematically. If you've ever been told that arterial plaque is permanent, that once it's there, you simply have to live with the threat, you're about to discover why that's absolutely not true. The medical establishment often focuses on managing symptoms rather than reversing the underlying problem. But when you understand that plaque formation is primarily a metabolic disease, not just a plumbing issue, everything changes. Your body burns fuel in specific ways, and when that fuel-burning system becomes dysfunctional, plaque begins accumulating throughout your arterial system. The presence of plaque in your neck arteries predicts plaque in your heart arteries with 98% accuracy, because the problem is systemic, affecting your entire vascular network simultaneously. The wake-up call came through an oral glucose tolerance test that revealed prediabetes hiding beneath the surface of apparent health. Drinking a measured amount of glucose and watching blood sugar spike over 160 proved that metabolic dysfunction was creating the perfect environment for plaque formation. Even without an official diabetes diagnosis, these blood sugar spikes were silently damaging arteries day after day, meal after meal. This discovery became the turning point that demanded a complete dietary overhaul. The transition from a low-fat diet to a low-carb approach wasn't just about cutting carbohydrates randomly. It required understanding which specific carbs were causing blood sugar chaos. Fiber-based carbohydrates didn't create problems, but glycemic carbs like pasta, bread, and highly processed grain products sent blood sugar soaring into the danger zone. Bread, once considered a staple of healthy eating and social connection, became one of the biggest offenders that had to be eliminated despite decades of enjoyment and cultural attachment to breaking bread together. Testing blood sugar after every meal became the ultimate feedback mechanism for determining which foods deserved a place on the menu. If a meal pushed blood sugar over 140, regardless of how healthy the packaging claimed it to be, that food was permanently removed from rotation. Oatmeal, long considered the gold standard of heart-healthy breakfast foods, surprisingly caused dramatic blood sugar spikes and had to go. Rice, which had become a dietary staple, also failed the blood sugar test and was eliminated. The new meal foundation consisted of foods that kept blood sugar stable throughout the day without causing dangerous peaks. Healthy fats like avocado, extra virgin olive oil, fatty fish including salmon and mackerel became dietary cornerstones. Natural saturated fats, previously vilified and avoided for decades, made a triumphant return including real butter and bacon. A breakfast of eggs fried in butter with avocado provided hours of satiety without spiking glucose, a stark contrast to the traditional blood sugar roller coaster created by traditional breakfast foods. The focus shifted entirely from counting calories and fat grams to monitoring blood sugar impact, a paradigm shift that transformed health outcomes. Moderate protein intake combined with plenty of non-starchy vegetables completed the nutritional framework that supported arterial healing. Different eating styles were experimented with over the years, including carnivore, keto, paleo, and plant-heavy low-carb variations. Despite the different approaches, one common theme remained consistent across all variations: keeping carbohydrates low and completely avoiding processed foods while preventing blood sugar spikes. Attention to fiber remained important even within a lower carb framework, with non-starchy vegetables and fermented foods providing the gut support needed for overall health. A large salad dressed with olive oil and apple cider vinegar, topped with salmon, became a go-to meal for both lunch and dinner. When traveling frequently and eating out regularly, a salmon Caesar salad became the reliable dinner choice. Grilled chicken with sautéed greens or occasionally a fatty cut of beef rounded out the meal rotation, though beef consumption remained moderate due to its tendency to cause weight gain. Brussels sprouts, previously despised, became an acquired taste driven by necessity and commitment to health. Even kippered herring made it onto the menu, though sardines remained an insurmountable challenge despite multiple attempts. Surprisingly, rigid dietary perfection wasn't required for success, as weekly indulgences of ice cream sweetened with allulose, stevia, or erythritol provided treats without wrecking blood sugar or undoing progress. This flexibility proved crucial because when your diet feels like constant punishment, long-term adherence becomes impossible. The key insight was understanding that saying you're on a diet implies something temporary, something you'll eventually abandon. What was needed instead was a permanent way of eating that could be maintained for life while still allowing enjoyment and satisfaction. The goal was creating a sustainable eating pattern that kept blood sugar in the safe zone and made plaque reversal possible without feeling deprived. When occasional blood sugar spikes did occur, panic was never the appropriate response. A simple walk or exercise snack consisting of lunges, calf raises, or jumping on a stationary bike would bring blood sugar back down very quickly. The critical factor wasn't avoiding every single spike, but rather minimizing the time spent with blood sugar elevated over 140. A brief spike to 200 that quickly returns to 100 is far less damaging than hovering at 160 for hours on end. The exercise transformation was equally dramatic, moving away from the endless cardio that once seemed like the key to heart health. Years of half marathons run weekly, sometimes twice a week, plus organized marathons and countless training miles seemed like the ultimate cardiovascular protection strategy. The truth learned through bitter experience is that long-distance cardio isn't necessarily bad, but it's far from the most efficient way to protect arteries or reverse existing plaque. What truly matters for metabolic health is building and consistently using muscle mass, especially in the legs. Leg muscles represent your largest safety valve against insulin resistance and metabolic disease, because when you engage these massive muscles, you pull sugar directly out of your bloodstream into muscle cells where it's safe and useful. This process rapidly lowers both blood sugar and insulin levels, addressing the root cause of arterial damage. The training approach shifted dramatically from logging 10 to 15 miles at a time to incorporating short, intense bursts of high-intensity interval training. With traditional high-intensity training, working at 90% effort for 40 to 60 seconds, followed by 1 to 2 minutes of recovery, and then repeating created powerful metabolic benefits. A newer variation called reduced exertion high-intensity training offers similar benefits with even less total stress on the body. This approach involves going maximum intensity for only 20 seconds, then recovering at a very slow pace for 40 to 60 seconds. Even just 2 high-intensity intervals using this method has been shown to have remarkable impact on arterial health and overall body composition.
The beauty of reduced exertion training is that despite the maximum intensity effort, it only lasts 20 seconds, and the session includes just 2 intervals total. This means you can complete the workout in the morning without feeling burned out or washed out for the rest of the day. These intense bursts could be performed on a stationary bike, running hill sprints, or even on a rebounder trampoline that initially seemed wimpy until experiencing how exhausting a flat-out sprint on one actually feels. The rebounder proved excellent for targeting calves, hips, and quadriceps with minimal joint impact. Resistance training was paired with these intense cardio bursts, but without requiring hours in the gym. Most days, resistance snacks consisting of just 5 minutes in the morning and 5 minutes in the evening, or even 2 to 3 minutes repeated 3 to 4 times throughout the day, proved sufficient. Wall squats, prolonged lunges, pull-ups, step squats, one-legged step squats, and calf raises using dumbbells, barbells, or body weight created the stimulus needed for muscle growth. Once weekly, a longer gym session utilizing all the machines provided a more comprehensive resistance workout. Also once weekly, a longer high-intensity session rounded out the weekly training schedule, with 3 to 5 reduced exertion sessions per week. The punishing long-distance runs were completely eliminated for several years, though eventually moderate 5-mile runs were reintroduced once or twice a week. The overall workout pattern became shorter, more intense, and more strategically targeted toward metabolic health. The results visible in lab work and arterial scans speak volumes about the effectiveness of this approach. The critical message for anyone starting this journey is that you don't have to begin at an advanced level. You start exactly where you are right now. Some people will be beyond this level, performing very heavy resistance work, while others are just beginning with daily walking. If walking is your current capacity, that's your perfect starting point. Adding short bursts of speed, incorporating a 10 or 20-pound weight vest or weight belt, and gradually adding resistance to your movements will build capacity over time.
Working toward building muscle and incorporating high-intensity work in small, manageable doses allows your fitness, blood sugar control, energy levels, and cardiovascular risk profile to improve progressively. Recovery became the next critical piece of the puzzle, demanding serious attention to sleep quality and stress management. For years, sleep was treated as optional, almost like wasted time since you're not conscious or productive during those hours. Staying up late to work and getting up early to run while telling yourself you're just one of those people who can get by on 5 or 6 hours became a dangerous pattern. Sometimes waking at 3 in the morning, unable to return to sleep, became normalized as just part of life. The truth that poor sleep represents a significant stressor that raises cortisol, spikes blood sugar, and drives inflammation throughout the body was initially underestimated. Sleep studies demonstrate that even when people report sleeping fine, subtle disruptions visible on the study lead to increased insulin resistance for the following 48 hours. Good quality sleep is far more important than most people realize, and certainly more important than it was initially treated in this journey. Cortisol elevation from insufficient sleep spikes blood sugar and drives inflammation, both of which directly feed plaque growth in arterial walls. One problem discovered through investigation was mild sleep apnea caused by a high, narrow dental arch that crowded teeth and pushed the tongue back into the airway during sleep. Sleeping on the back allowed the tongue to fall backward more frequently with age, causing dozens of brief awakenings throughout the night without conscious awareness. This issue was addressed through Invisalign braces that widened the dental arches and provided significant relief. However, dental correction wasn't the complete solution, as learning to sleep on the side instead of the back required deliberate training and proved challenging to master. That single change improved oxygen levels, lowered blood pressure, and dramatically enhanced sleep quality and daytime energy. Chronic stress represented the other major recovery challenge after decades of operating at full throttle, where high stress levels felt completely natural and normal. Attempts at meditation and slow breathing techniques didn't seem to help initially, leading to abandonment of those practices. Chronic stress keeps your body locked in fight or flight mode, maintaining a low-grade inflammatory state and keeping cortisol levels chronically elevated. Breaking this cycle required finding an effective daily practice that actually worked, rather than just sounded good in theory. The breakthrough came with practicing slow, controlled breathing, not just taking occasional deep breaths, but
but systematically slowing the breathing rate to half of normal. Instead of the typical 15 to 20 breaths per minute, the goal became 7 to 10 breaths per minute. From a physiological perspective, this breathing pattern slightly increases carbon dioxide levels, which opens blood vessels in both brain and body while stimulating the vagus nerve. The vagus nerve acts as the switch that activates rest and repair mode, sometimes called rest and digest mode, counteracting the chronic stress response. Learning the proper slow breathing technique came from experimenting with a biofeedback device that used a strap around the belly and earphones to coach the precise timing of inhalation and exhalation. This experience revealed that previous attempts at slow breathing had failed because the breathing rate wasn't slowed down nearly enough to trigger the physiological benefits. You can achieve these benefits without any biofeedback device by simply sitting or lying down, inhaling slowly for 4 or 5 seconds, exhaling slowly for 6 to 8 seconds, and repeating this pattern. Just 10 minutes of this breathing practice creates a noticeable difference in stress levels and overall sense of calm. Sleep and stress control don't merely make you feel calmer, they create measurable impacts on metabolic health markers. Better sleep quality lowers fasting glucose and blood pressure, while reduced stress decreases inflammation markers throughout the body. These two factors alone can eliminate a huge portion of cardiovascular risk without any other interventions. These represent the fundamental lifestyle changes that created the foundation for arterial reversal. The approach might sound simple in theory, but for many people, starting and maintaining these lifestyle patterns presents significant challenges. Consistency is absolutely key to success, but as we age, our bodies don't possess the same capacity to respond quickly as they did in youth. This reality is why strategic supplementation became an important part of the overall approach. Traditional medical training emphasized that supplements just created expensive urine, dramatically underestimating their potential effectiveness. After the reality check of discovering advanced arterial disease, extensive research into supplement science revealed surprising findings. Developing clear opinions about the best types of supplements for prevention required analyzing published research with the same rigor applied to medical studies. The supplement philosophy became filling dietary gaps that can't be covered through food alone, supporting specific individual needs, and relying only on evidence-backed interventions. Vitamin D3, at approximately 5,000 international units daily, became one of the first supplements added to the regimen. Low vitamin D levels are clearly linked to increased inflammation, higher cardiovascular risk, and compromised immune function throughout the body. Vitamin D3 was never taken alone, but always paired with vitamin K2 at about 400 micrograms daily. Vitamin K2 helps direct calcium into bones and teeth rather than allowing it to deposit in artery walls where it contributes to calcification. More importantly, emerging research suggests vitamin K2 plays a role in improving insulin resistance, which will likely be confirmed as research continues. Another supplement used strategically was niacin, primarily to address low HDL cholesterol levels. Niacin represents the only supplement or medication that can simultaneously increase HDL, decrease LDL, decrease triglycerides, and, most importantly, decrease lipoprotein (a). Magnesium supplementation included multiple forms rather than relying on just one type. Magnesium L-threonate provides excellent support for brain health and sleep quality, while magnesium glycinate supports muscle function and promotes relaxation. Magnesium participates in over 300 bodily processes and plays crucial roles in blood pressure regulation and insulin sensitivity.
Despite eating substantial amounts of fish regularly, supplementation with additional omega-3 fatty acids provided insurance against deficiency. The combination of EPA and DHA, the two most important omega-3 fatty acids, has been proven repeatedly to provide significant cardiovascular risk reduction benefits. Other supplements used periodically include aged garlic extract and nattokinase, both supported by evidence showing positive impact on arterial plaque. The next strategic piece, while controversial, involved carefully selected medications used for specific purposes. Before discussing specific medications, one principle must be absolutely clear. Medications are never the main driver of plaque reversal or prevention. You cannot out-prescribe a bad lifestyle, no matter how many pills you take or how expensive they are. When medications are used strategically, though,
In the right dose, at the right time, for the right person, they can help stabilize existing plaque or prevent new plaque formation while lifestyle changes perform the heavy lifting. One of the first medications chosen was a low-dose statin, which generated substantial criticism from various quarters. The goal wasn't to hammer LDL cholesterol into the ground, but rather to lower inflammation and protect against recurring inflammatory episodes. Understanding that plaque formation involved repeated episodes of inflammation that couldn't be felt led to seeking a backup for lifestyle interventions. Low-dose statins have demonstrated effectiveness in reducing cardiovascular inflammation, making this the primary target for intervention. Most importantly, statin therapy began only after discovering existing plaque, because inflammation is what makes existing plaque unstable and dangerous. Strong evidence supports that low doses of certain statins, like rosuvastatin or pravastatin, can effectively reduce inflammation without the side effects associated with high doses. The high-dose approach and more problematic statins like atorvastatin were deliberately avoided in favor of rosuvastatin at just 5 milligrams daily or even 2 to 3 times weekly. Some patients achieve positive results with just 5 milligrams once weekly, a dramatically different approach from standard prescribing practices. When comparing weekly total dosages, patients taking 40 milligrams of atorvastatin daily consume 280 milligrams weekly compared to just 5 milligrams weekly, representing completely different universes of medication exposure. Low-dose aspirin was also used initially, requiring explanation of why it was started and why something different is used now. When aspirin therapy began, it was recommended for primary prevention in people aged 65 or older, with some guidelines suggesting 60 or older. Primary prevention means taking medication based solely on age without documented cardiovascular disease or specific risk factors. Having heart disease, which by definition means having documented plaque, moves you out of primary prevention territory into secondary prevention. Those same guidelines confirm that aspirin works effectively for secondary prevention in people with documented cardiovascular disease. Although aspirin was recommended for primary prevention at the time therapy began, it wasn't started for that reason. Upon discovering existing plaque, the realization came that this meant being a cardiovascular patient requiring blood-thinning protection. Baby aspirin at 81 milligrams provided the blood-thinning effect needed for someone with documented arterial plaque. Of course, aspirin carries bleeding risk, making this a discussion that must happen with your personal physician. Notice the phrase "used to take" regarding low-dose aspirin, as the medication was eventually discontinued. The change wasn't due to aspirin ineffectiveness or side effects, but rather because of a new diagnosis. Several years later, atrial fibrillation was discovered, the most common heart rhythm problem which significantly increases clot and stroke risk. Atrial fibrillation raises stroke risk 6 to 8 times, and aspirin simply doesn't provide adequate protection against this dramatically elevated risk. The necessary switch was to a novel oral anticoagulant, specifically apixaban, replacing the aspirin regimen. Interestingly, apixaban has shown similar protection against heart attacks as low-dose aspirin, but provides dramatically better risk reduction for strokes associated with atrial fibrillation. In the late 50s, high blood pressure began developing, initially managed with ramipril, an ACE inhibitor blood pressure medication. Doctors had been using ACE inhibitors quite frequently, but not typically as frontline high blood pressure management at that time. Eventually, the switch to losartan, an ARB which is similar but different, became necessary due to persistent coughing with the ACE inhibitor. Keeping blood pressure in the optimal range represents another critical way to protect arteries from ongoing damage over time. A low dose has helped maintain steady, controlled blood pressure numbers while protecting kidney function. The essential point is that every medication was added for a very specific reason based on test results, risk profile, and physical examination findings, including blood pressure measurements. All medications are reviewed regularly, and if a medication isn't providing benefit, or if improvement makes it unnecessary, changes are made. Medications function as tools that work best when targeted, monitored, and used for support, rather than replacing the real drivers of cardiovascular health. Exercise, sleep, stress control, and nutrition remain the foundation that determines success or failure in reversing arterial disease. One critical piece that most people completely miss, even more important than lifestyle interventions, deserves attention before concluding. Many people struggle with a medical system that simply pushes pills without truly listening to their concerns or addressing root causes. So many people attempt to figure out cardiovascular health completely on their own, which, while admirable, can lead to serious blind spots and mistakes. Doing your own research is valuable and important, but going completely solo puts your health at unnecessary risk. This recognition led to dedicating an entire career to a different approach after formal training in prevention and eventually running the prevention program at a major medical institution. Understanding both the strengths and limitations of traditional preventive medicine created the foundation for training a team of clinical advisors. These advisors take the same approach, listening carefully and examining the real drivers of heart disease and plaque formation, including inflammation and insulin resistance. The focus extends far beyond just checking LDL cholesterol and calling it a day, which represents standard practice in most medical settings.
When you connect with this team, you receive more than just an appointment. You gain guidance and support specifically designed for your unique situation, your personal numbers, and your individual goals. Finally, having somebody in your corner helping you make informed decisions transforms the frustrating experience most people endure with conventional medical care. If you're ready to move beyond frustration and access prevention strategies that actually work, resources are available through links in the description. Calling the provided number connects you with knowledgeable team members who can discuss your specific situation and answer questions. A free comprehensive guide covering metabolic health, risk assessment, and arterial plaque reversal strategies is available for download. These resources help you learn about your personal risk factors, how to fix metabolic dysfunction, and the specific steps needed to reverse arterial plaque. Purpose represents the final element that holds everything together, though videos on this topic admittedly aren't particularly popular because people dismiss purpose as abstract nonsense. Purpose is absolutely not abstract nonsense, but rather the foundation that sustains long-term commitment to health transformation. When that first scan revealed the arteries of a 73-year-old at age 57, the initial emotion was intense fear. Fear alone never keeps you going for the long haul when the initial shock wears off and daily life presents constant temptations and challenges. Purpose provided the sustained motivation needed to maintain lifestyle changes year after year without wavering. The first aspect of purpose was wanting to be around, not just alive, but genuinely healthy and vibrant for the people who matter most in life. The second aspect involved turning a personal wake-up call into something that could help other people avoid heart attacks, strokes, blindness, kidney disease, and all the devastating complications of cardiovascular disease. This is why sharing these scans, these numbers, and these specific steps taken feels so important and meaningful. The experience of thinking it's too late, followed by the incredible relief of discovering it's not too late, creates a powerful desire to share hope. When you have a clear purpose that's bigger than momentary feelings, the daily choices become significantly easier to make consistently. Your purpose needs to extend beyond how you feel today and beyond simply following doctor's orders, because external motivation rarely sustains long-term change. The experience of retiring 3, 4, 5 times, maybe more, always led back to sharing knowledge that helps people find hope and avoid cardiovascular disasters. This purpose of making people's lives better through actionable information provides the anchor that keeps you steady when life inevitably gets messy and complicated. When you're tempted to fall back into comfortable old habits that feel easier in the moment, purpose pulls you back to your commitment. If you don't have that clear purpose yet, take dedicated time to think deeply about what matters most, because it's the single most important thing you can do. Once you know exactly why you want a longer, healthier life, the specific how-to steps become dramatically more doable and sustainable. Your purpose doesn't have to be grand or world-changing. It just needs to be deeply meaningful to you personally. Perhaps your purpose is being present and active for your grandchildren, finally taking that dream trip you've postponed for years, or simply maintaining independence and vitality as you age.
Maybe your purpose involves proving to yourself that you're capable of transformation, or showing your family that health challenges don't have to define your future. Whatever your purpose, write it down, revisit it regularly, and let it guide every decision about what you eat, how you move, and how you care for yourself. The combination of purpose-driven motivation with evidence-based lifestyle strategies creates unstoppable momentum toward arterial health and longevity. Now you understand the complete framework that reversed decades of arterial damage and transformed cardiovascular risk from critical to minimal. You've learned that arterial plaque isn't a permanent sentence, but rather a reversible condition when you address the metabolic root causes. You've discovered that blood sugar control, strategic exercise focusing on muscle building and high-intensity bursts, quality sleep, stress management, and targeted supplementation work synergistically. You've seen that medications can play a supporting role when used wisely and specifically, but they never replace the fundamental lifestyle drivers. Most importantly, you've learned that purpose provides the essential foundation that sustains long-term commitment when motivation wavers. These aren't theoretical concepts, but rather the exact steps that produced measurable, documented reversal of arterial disease over multiple years. The scans don't lie. The numbers tell the truth, and the dramatic reduction in cardiovascular risk is real and achievable for anyone willing to commit. If this video has opened your eyes to new possibilities for your own cardiovascular health, please hit that like button right now to help others discover this life-saving information. Subscribe to this channel if you want more evidence-based content about preventing and reversing heart disease, optimizing metabolic health, and extending your healthy lifespan. Drop a comment below sharing your biggest takeaway from this video, any questions you have about implementing these strategies, or your own experience with arterial health. Sharing your thoughts helps build a supportive community where we learn from each other's journeys and celebrate victories together. If you know someone who's worried about their heart health, who's been told they just have to live with their risk, or who feels confused by conflicting medical advice, share this video immediately. You might literally save their life by introducing them to information their doctor never discussed. The knowledge you've gained today represents decades of clinical experience, personal experimentation, and scientific research distilled into practical, actionable strategies. Don't let this information sit unused. Take the first step today by implementing even one small change from what you've learned. Remember that transformation doesn't require perfection. It requires consistent progress in the right direction, guided by clear purpose and supported by evidence-based strategies that address root causes rather than just managing symptoms.